Greg Price was born in Alberta on April 5, 1981, the second of 5 children. A mechanical engineer by profession, he enjoyed being active, spending time with family and volunteering as a baseball coach. On May 19, 2012, Greg passed away after spending much of the previous year navigating a disconnected healthcare system. While his care providers had good intentions, there were multiple breaks in communication that caused significant treatment delays for Greg, who had testicular cancer.
He went through a period of a little over a year where he had initial, not very high concerns about a health condition, and then that gradually built up for the last 3 months or so. He became more concerned about the situation, actually engaged healthcare providers in a couple of different ways, and ended up going through a process where it was pretty disjointed and it had breaks in it, and at the end of it ultimately passed away.
The Alberta Health Quality Council conducted a thorough review of Greg's journey under the direction of Dr. Ward Flemons. It released a report in December 2013 that made 13 recommendations, including several that spoke to the role of digital health in avoiding communication breakdowns between clinicians and a patient's circle of care. Providing patients with electronic access to their own health information was among the recommendations.
Well, I think a key concept that we brought out in the report was that if patients are fully engaged in their care, they're safer patients. But in order to be engaged in their own care, they need information just like the rest of us. And so I think the role of digital health is two really for patients. Number one, it's to provide them information or access to their own health information. But the second one is so that they can see their journey through the healthcare system and find places where it may have fallen apart, as it did in Greg's case, so that they're given the tools and the ability to actually pick it up and carry it to the next provider who's supposed to be giving them care. And a lot of patients just assume that no news is good news when that's actually not the correct assumption.
According to a Harris Decima study commissioned by Canada Health Infoway, 89% of Canadians feel it is important that they personally have full advantage of digital health tools and capabilities. As for David Price and his family, preventing future tragic losses like the one they recently suffered is just one of the many reasons they would like to see patients have digital access to their own medical records.
Out of that has to come change. And if it's empowerment at the patient level through being able to have better access to their own records and be able to ask good, knowledgeable questions about where it's going, or to be a better partner with the treating physician so that they can actually collaboratively work together to have things happen, then that's all a very good thing.